Hi, it's Charlene Campbell here, and I wanted to come on today and talk a little bit about postpartum and labor and delivery during a low resource setting. Um, Perhaps a time when this is my feeling on it, that as we move into these tribulation days, that we will have so many pandemics that are kind of mounting, different ones. We'll have breaks and then there'll be bigger ones. And that the hospitals actually will become a place where you don't want to go there and have a baby. So the reason I'm going to do these I'm going to try to make them between 7 to 15 minutes long, so they're not too much for you guys to watch. But if, like, my goal is to have a team in every single community in the United States and Canada. I mean, in every country in the world would be ideal, but start where we are. But with everything that's coming and everything that's going to be happening, as we, I think, are transitioning into just a new era of time where things are going to get better. But, they usually get a little worse before they get better when you've had a lot of corruption. So we're moving into some unstable economic times, some unstable times with these plagues. Some of them are man-made, some of them are bio-created in war plague type energy. So whatever doesn't really, I think what we need to focus on is our locus of control. And our locus of control right now is knowing things are coming. If we're awake and we're alert and we're listening to the Spirit, then we can do something about this by being ready now. And so that's one of my purposes here with this program. All of my work that I do, my whole life is dedicated to this for the last 7 years. And that is preparing to have less suffering and less trauma and less deaths and less illnesses because of childbearing during the tribulation period, which is what we're coming on to right now. So no need for fear. Just you take all that energy and just put it into something constructive, and it's fantastic, So I've been kind of thinking about what would be a good topic for my first time of doing these, because I'm going to try and do them once a week. Hopefully I can be, how you like my leaf? Be consistent with that, and come in and help teach people who want to learn more. And my goal is to teach the layperson as well as the practicing childbearing providers, all of them, because most childbearing providers work in a high resource setting, so they're not used to dealing with the issues and challenges of the low resource setting, which is what I'm specialized in. So everything that I teach you is going to be with that kind of end in mind, that this information is created for the layperson. It should be easy to understand. Please ask me questions or email me at charlene@birthjoyeducation.com if you have any questions. Okay, I'll get into the topic for today, which is, what is the difference between a doula and a midwife's assistant? And I've been thinking about this as time moves forward, that it's nice if we have terms that we can all agree, what do these terms mean? And I've noticed that people generally get the word doula and midwife mixed up a lot, and then they're so different that it's really significant. But just a general thing is that a doula is more of an emotional support person, physical support in the sense of like helping her move or get her drinks or help her get to the bathroom or, give her some emotional support, but no medical support at all. So that's really, a very, very light definition of a doula. And then with a midwife or a midwife assistant, their primary purpose and sort of role in that delivery is the medical, the the well-being of the mother. So that could include emotional needs too. But if there's a doula there meeting those needs, that can be really helpful. Her partner can be part of that team as well, of course, always. And that's ideal. But the studies show, so just as far as, hardcore research, there's some really hardcore research on doulas right now. And it's all really super positive. So the research says that doulas create, I think it's 60% more satisfaction with partners. So I think what happens at birth is if a man is feeling, or a partner, whoever that may be, is feeling pressured to be something really specific for that person and meet all their physical needs, like running to get food, helping them up to the bathroom, doing all that, they can get really exhausted. And my experience has been that in my practice, I have had kind of a policy that, unless the mother really doesn't want a doula, we will get her a doula. Even if we can get, if she can't afford it, we'll find her a doula for free. And in my clinic that I plan to open here in Rexburg at some point down the road when it's time, we are going to have a doula program as well, where there's on-staff doulas in the birth center. So you just have a doula. There's always going to be a doula there for you, because it's nice, because then the partner can have a nap, or they can just, be right there looking in your eyes and giving you all that moral support that you need. And the other person, the doula, could actually be supporting that and grabbing things for you, maybe even massaging your partner's shoulders because he's been doing some stuff with you that's hurting, that's kind of getting him a little sore. And then you can just see, I've been at so many births like this, and it's just, when it's all functioning like a Swiss clock, it is just amazing, because everyone's ministering to each other around the woman, And so, as a midwife's assistant, your role really isn't to minister to the woman. Like the doula's role is to minister directly to the woman. Your role as the midwife assistant is to minister to the midwife or the main care provider, because then you're making sure she's okay. Like if she's suturing, you could be wiping her brow. If she's sweating, you could be giving her a sip of water if she really needs it. Stuff like that. You could be making sure that she has her needs met as much as possible, and of course making sure that you have your own needs met is very important when you're working in those roles, so that you have your cup always full and you have that kind of ability to take care of yourself really well and not get depleted in your own energy, so that you're able to serve and minister and be conscious of other people's needs and able to respond appropriately. Okay, so let's go into so what is a doula and what is a midwife assistant? So let's start with the doula first, and because some people don't have a clue, and I know some people probably do know quite a bit about doulas. I know a lot of my people that follow me do. But just to give you some more information about that, this is kind of a general idea of a doula. The mother really needs to urinate. I mean, these are just some basic things. She should be urinating every 2 hours. So one of the doula's roles is to make sure that the fluids go in and the fluids go out. And she should be sipping on water or some kind of, fluids, not too sweet, probably. Sometimes women will make their own Gatorade, kind of a natural Gatorade, and I put the recipe on my Facebook recently, so you can look that. I think that's a really good thing to have on hand. And then, so the doula is going to be helping the mother facilitate her labor, with letting the mother have the lead, but she's going to be there, to assist her and to help her. So some of the things that might be, if the mother's discouraged and she needs a change of scenery, so the doula might suggest that. The doula might do some breathing with her, look in her eyes and say, hold her face and say, I'm here, let's do this together. Let's slow this down. Let's slow this down. Breathe with me. Look in my eyes. Okay, now you can, when someone's breathing really fast or talking really fast, that's an indication that they're kind of panicking, right? And they're losing control. And then when you get this really shallow chest breathing, It's really hard to maintain your composure when you're doing that because you're not getting enough oxygen to you or to the baby, right? So we really encourage the slow, deeper breathing. Unless there's a couple exceptions to that rule. One would be if she's pushing the baby out. And she's, well, one would be if she feels like she has to push, but she's not supposed to be pushing yet. She can pant. And she could do long blows too, so she doesn't hyperventilate. Always have a bag ready if she starts to, look like she is. But longer on the out breath is the key to reoxygenating and not getting too much of the wrong kind of air. So just, long out breaths. Sighing is really good, and even audible sighing. So sometimes the doula the midwives, they can overlap in this area, of course, in this emotional support, physical support area. We overlap, the doula and the midwife. But then there's some areas where we just don't overlap, like in the area where the midwife has the medical responsibility, where she's like taking the mother's part, pulse and blood pressure and temperature, and making sure that the baby is, has a good heart rate. And of course, they would have made sure that the baby was the right size for dates, and that the baby was within the right parameters for the delivery. But like in the case of a low resource setting, for example, like what I'm really wanting to kind of touch on this in this film, excuse me, but in the low resource setting where you don't necessarily know and ahead of time, say the pandemic suddenly got really bad somewhere in Rexburg or something, and the Madison Hospital became really contaminated, and suddenly people had to like birth out of hospital. So, you really need to know how to support physiologic birth. And I think that should be the main role of a doula, is to help the mother to see the ways that she can support herself with physiologic birth, because that's going to make her birth less interventions. And that's what the studies show. Actually, the studies do prove this, that a birth with a doula has less interventions, and you have a better outcomes. You just have better outcomes because interventions create problems. And so, so doulas are a really, really important part of a team. I think coming up with the birth team idea is really good, because it's not like all on one person. If the mother's going for long periods of time, people can spell each other off, and it's really nice. So, but as far as in the low resource setting, is if you don't follow the natural physiologic management of the labor, delivery, and postpartum, including breastfeeding, that includes following the mother's lead, letting all the hormones naturally rise, not interfering and if you do that in the home setting, if you do all these things and you honor these sacred milestones of birth and labor and postpartum and the newborn's attachment and everything, that goes right through to laid back breastfeeding, where you're not trying to put the nipple in the baby's mouth. No, that baby needs to imprint. Imprinting is very, very vital for that newborn's emotional, physical, mental, spiritual, and physical well-being. And especially in a low resource world that we're coming into, they need that. And they need to be able to breastfeed, or they don't survive often in the really bad disaster settings or civil unrest, places where there's issues. Because we know that we've got a drought right now, and we know that there's going to be cut off of the world food supplies, so we can't be relying on formula. And so we need babies that know how to breastfeed. And when they have that imprinting early, it literally creates this muscle memory so the baby knows how to breastfeed. They never forget that. But if you're stuffing the breast in their mouth, you're forcing them to breastfeed in a way that isn't completely congruent with the physiological nature and design of things, God-given, then you will disrupt. It's an interruption. Anything that's an interruption causes the hormones not to flow like they're supposed to. So that goes for the child, for the mother, and I think for the dad too, the dad, if he's in a really harmonious environment where the care providers are really in tune with the mom and the mom's able to allow the labor to progress normally without intervention, and a lot of that shaming and where the mothers we're so insecure and it's like somebody else is doing it to them, that doesn't create good child mother bonding or parent bonding. And I think what happens is when you have a doula, that doula is educating them. She's doing informed discussions with them about, decisions that they have to make. Well, what are the risks? What are the benefits? What if we do nothing? And, what are some of these options that we have here, and what should we decide? So the doulas that help her in that department, so can the midwife also be, of course. And but the doula has that advocacy role for the mother herself, and that's a really big thing. So let's just go through. I've got a couple of cards, and I'm already at my 15-minute mark. So let's move forward. It's going to be a little bit longer, but so I talked about the bathrooms and fluids. I talked about the importance of position change, and of course, emotional support can come in the way of guided visualizations. And I think putting imagery, it can be really powerful. Music, imagery, dancing, drumming, and also rebozo. And this is a rebozo. I'll talk more about the rebozo in one of my other classes, but it's a really helpful thing for birth. Okay, and so those are some basic things that a doula or a midwife could do, or a midwife assistant, but generally the doula, if she's there, will do those. And then of course the mother will be cared for by either the midwife or who's ever helping her. Now in a low resource setting, that could just be a layperson, so you wouldn't necessarily be taking her blood pressure or any of those things, because that's not your expertise. That's not you. That's not what you do. You just took a short little course, and you're here because this woman has nobody else. And this happens every single day. Every one of my classes, I have people telling me stories. Actually has happened a lot in this valley, Rexburg Valley, which is kind of interesting to me how much it happens here, but of course there's big families, right? The labors can get really quick at the end. If you've got like 5 or 8 kids or something like that, they can get super fast. It's just called precipitous birth, and that can make it so that you can barely make it to the hospital and people don't. So anyway, people should know how to help, right? And but anyways, that's my goal really, is to teach people to not be afraid to step in and say, hey, how can I help? Because usually most birth doesn't need intervention, especially if it's precipitous, especially if it's happening quick and there's no time to go anywhere. But it could be a situation where, everybody's like sick at the hospital, and there's been babies, reported dying there after birth and all this stuff, so you're just not really willing to risk it. I'm sure this has happened many times, and I'm sure it will happen again. So what would you do? Well, you would keep the mother hydrated. You would make sure she's well rested. You would make sure that you know how to time her contractions, so you're not starting her into thinking she's an actual active labor beforehand, because that can cause mothers to get really tired if they actually think they're in labor when they're actually not. So they're not in labor until their contractions are about 4 minutes apart, lasting a full minute or more, and you've had that for 1 or 2 hours. 1 hour if she's had more babies, 2 if she's having her first. That's active labor. That's when you start really focusing on it and breathing and all that. And before that, you should try to just keep busy maybe making some food. You might stop and lean over, breathe, but you continue to do things so that you just don't put all your focus on the labor until it's fully active. Okay, and then the other thing that, of course, I'm just going to say, as a midwife assistant, these are just some of the things that you would want to do. I think this is going to end up being probably 25 minutes. That's okay. All right, so some of the things you want to do are know how to set up for the birth. And if you're in a low resource setting, that just means find some towels, find some clean, absorbent cloth. find a receptacle that she can throw up in, pee in, void in, throw up, whatever, have the placenta in. And then if you have the capacity to get, of course, somebody trained there, you try to phone them, but if you can't, then you need to clear the area, have someone go get some of those things for you if the birth is going to happen right away and you don't have time to go run and get them, like she's pushing the baby out, basically. Give other people assignments. And you can use a human wall. You can have people put their backs to the woman if you're in an auditorium or a gym or a church or something like that. But privacy is extremely important for the low lighting if you can, quiet, and privacy for those hormones, like I talked about, that hormonal cocktail, to really keep it functioning and working and everything in the body the way it's supposed to with that hormone cocktail. That is the key to the whole thing working, because if you don't have that working, you're not gonna have a good strong contractions, because all that stuff makes everything work. So the woman has to feel safe. She needs to feel, and even if she's kind of freaking out, she can still acclimatize and adjust with you bringing in the calm, bringing in the peace, and bringing in some calm, slow words. Really pacing is a big one. Slowing it down, slowing the breathing down, slow your talking down. Get all the fear or energy of, being afraid out of you, because there's no point. You just do the best you can and you listen, and you're much more able to listen when you're not afraid. You're much more able to hear the Holy Spirit. Okay, so some of the things that you would be wanting to do is have stuff for under her, have stuff to keep the baby warm after, keep the windows and doors closed if you can, to create no drafts if possible. Have warm blankets or bedding or towels or something for afterwards. Water for the mom, maybe some food for the mom if you have it. Maybe some sanitary napkins if somebody can find some for after. Yeah. Okay. So those are just, if you can get the idea between a midwife and a doula, is the midwife is the person that needs to take care of the more the medical side of things, which I don't even like to use that word, because birth really isn't a medical event. Birth is a natural physiological event. It is. It's meant to be happening at home. I know it. And in cultures where it does, like Denmark, they have a 2% cesarean rate, and we have a 60% cesarean rate. They're 2% on the infant and maternal mortality rates, like as far as their deaths are so low. It's like the lowest in the world, because they use midwives and they do home birth. And they collaborate really well with the obstetricians, the pediatricians, and the neonatologists, and they have teams. But low-risk moms, they birth with midwives, and they have very low intervention, very low cesareans, and their rates are the best in the world. And guess what? Ours are some of the worst. Ours are worse than all the civilized countries. We're 37th or something into the third world. So yeah, it's because technology creates a lot of intervention, and that creates a lot of morbidity and mortality with newborns. Anyways, I hope you've learned something, and I will try to do this once a week. And if you have any topics that you want me to explore, specific emergencies or specific topics to do with home birthing, what it's like to be at a home birth, it's definitely different than being in a hospital birth. It's more woman-centric rather than provider and institution-centric, which is really harmful to women and to their bodies and to their babies. Anyway, I hope you have a blessed day. Take care. Bye-bye.